Mina Aissatou Sise, Intellectual Network at the National Emergency Operations Center concerning the press conference we then get on the coronavirus in China. Now we dey go na the hall outside the conference will take place.
We have other staff members around, and Mr. Safia Boy is the communication officer for the World Health Organization, and also we have our public relations officer, Mr. and we would be doing introductions as we would ask when you would ask questions. I would go straight to the presentation now. We have two presentations, and that is the facts on coronaviruses. So it is important for us, to know these facts so that we'll be able to diffuse this important information to the general public. The 2019 novel coronavirus is a new virus that can make people sick. The coronaviruses are a large family of viruses that can cause mild to severe illnesses. Even the common cold we have that we call fresh cold is as a result of coronavirus. But the 2019 novel coronavirus, that is why it's called novel, because it's a new type of virus that has been mutated, has changed its form to cause serious illness. It started as a result of an outbreak that they had in China that was declared on 7th January this year. So sicknesses from this 2009 novel coronavirus can range from not too serious, as I said, to very serious, and even death in some cases. The 2019 coronavirus can spread from person to person. As the saying goes, coughs and sneezes spread diseases. That is evidence of the coronavirus. It can be spread through droplets. It's a droplet infection, airborne. So it can be caused by spread by coughs and sneezes. And even when you talk or breathe, if you are very close to each other, you can actually spread or transmit the virus. There are everyday actions that can be taken to protect ourselves, our families, and our communities from this virus. Let's go. The signs and symptoms are the fever, cough, difficulty in breathing, and general feeling of unwell. So these are the cardinal signs of coronavirus infection. You can get some or all of these signs. This is just pointing to the fact that if you have these signs, you are suspected of having coronavirus, but you will be only confirmed as a patient or confirmed case when laboratory investigation is being done and it is positive for 2019 coronavirus. Let's go. How to protect yourself and others. Again, this is very simple. Hand washing is the key. You wash your hands with soap and water. And washing hands with soap and water frequently is one of the best ways to keep healthy and help stop the spread of the disease. Again, if you can afford, you can use alcohol-based hand rub, what we call hand sanitizer. Do not touch your eyes, nose, ears, and mouth with unwashed hands, or even when you touch surfaces like tables, door handles, and all of these that have been infected with the virus that causes the 2019 coronavirus. So you should make sure that your hands are washed frequently. Cough or sneeze into your upper hand, that is the back of your elbow, if you do not have a handkerchief or a tissue, the back of your sleeve, your arm. And then to help keep others safe from sickness, wash your hands afterwards and make sure you safely dispose of the tissue or what you use to cover your mouth while coughing or sneezing. Keep a safe distance from anyone who has a fever or a cough. You should be at least 1 meter from that person, at least 1 step from that person. Okay? Okay. What to do if you have signs and symptoms of coronavirus? Avoid travel if you have a fever or cough. If you have signs and symptoms while traveling, inform your crew so they can help you get the care you need. For instance, if you are in a plane or a ship or even in a vehicle, you inform the authorities or the driver so that they can take you to the nearest health facility. Getting early treatment can protect and save lives. It's important for you as a person to be treated early or to be managed early. And also, it's also important for you not to spread it to other people around you. Okay? What to do if you have signs and symptoms? Continued. If you have fever, cough, or difficulty in breathing, go to the nearest health facility or contact your health worker right away. Make sure to tell the health worker if you or someone you know have traveled to another country in the last 14 days. Because the reason is the incubation period is 2 weeks or 14 days. Within that time, you would have shown some signs and symptoms if you are not the asymptomatic type. Because there are very few, less than 1%, who would have the illness without showing signs and symptoms. Get early treatment. Getting early treatment can protect your family and loved ones from getting sick. Okay, let's go. So with this, I want to thank you very much. These are the basics, and if we know these basics, it's important for ourselves personally and for others. And the instructions are very, very, very simple, and the signs and symptoms are also very simple. So we would not pause for any question as at now. I would hand you over to the director, Dr. Vandy, to just take us through what the government or the Ministry of Health has done, to prevent any importation of the virus to Sierra Leone. So I would hand you over. Over to you, sir.
Yes, thank you very much, Harold. And let me join Harold to thank you for your time. I understand some of you are coming from as far as Pujeong and Cambia, where we have some of the major POEs, that is point of entry, the Balamoya crossing point and the Gendema crossing point, as well as our colleagues here in Freetown and other parts of the country. So thank you very much for your time. Of course, we are here to listen to what government have done or what the ministry have done regarding the outbreak that started in China, the coronavirus outbreak. Much have been said about the outbreak, I'm sure, and you are following the news on the statistics, how many people being affected and where. So I'm not going to go into that because that statistics is changing by the minute. This morning, I read it's about 400 and something that died already in China. But by now, if you check the news, it's more than that. New cases are popping up in China and in other countries. So that statistics, as I said, is very fluid. The virus itself is new. That's why they call novel. It is part of the family of viruses they call coronavirus. This is the 7th discovery, the 7th one. There are 6 known that cause diseases in humans and also in animals. In fact, that is why it's suspected to have originated in a bat in China. And that is what we call zoonosis. These are viruses that affect both humans and animals. This is the first time this is coming up. That's why they call novel coronavirus. Similar virus is what that is affecting us. Commonly we call common cold. It's one of the viruses that we are all aware, which does not keep us in bed. We go around our businesses and it get past. The other one, part of that family, calls what we call MERS. MERS is Middle East Respiratory Syndrome. We never got that outbreak here, but it caused a lot of problems in China and in the Middle East and other parts of the world. Thousands of people were killed during that outbreak in around 2002. The same virus, this same coronavirus, another subtype, is responsible for SARS. SARS is Severe Acute Respiratory Syndrome. Severe Acute Respiratory Syndrome. That also occurred in China and in the Middle East and around the world. We didn't get that one here. The first one now we are talking about now, the last one now we are talking about is the coronavirus, which is the novel. It's a new one. That is the seventh member of this subtype of coronavirus. It is very infectious. It is spread by airborne, and that's what makes it very, very difficult to handle as compared to Ebola. Ebola virus is more virulent, but it is not airborne. So it is comparatively easier to handle surveillance-wise, epidemiology-wise, than this, because this was airborne. Airborne, that's why the advisory is if you are not very, very pressed to travel, you should avoid traveling now, because in the process of traveling, when you are breathing in, breathing out, if you are infected, you can affect somebody next to you, or you can affect your loved ones. That's why some countries have already put travel ban, according to WHO. But in fact, WHO is not recommending travel ban. Some countries have done that on their own. Okay. As Harold said, we have seen the signs and symptoms. It has killed so many people. But the case fatality rate, although it's not accurate because we don't have accurate figure of those that are affected or they are positive. Okay? Because it's only the severe ones that die. So if you want to calculate the case fatality rate, you may not get it accurate. As of now, it is put at 2%. While Ebola is about 60%. So you can see the difference. 60% case fatality for Ebola and even for Lassa fever, and then 2% against this. But then this is difficult to contain because it's airborne. So this is the background of the virus. And even strong countries like America, like England, France, they have all recorded this case. We all know the strength of China. China now is an economic power. So because of that, and the timing of the outbreak is very crucial. The timing of the outbreak came out during the Chinese New Year festival. And that is the time people move. That is the heaviest movement of people on earth. That is why you are doing millions of people are moving in different directions in the same country. If you go to China at this time, nothing works because everybody's on holiday. So, and this is the time the virus decided to hit. And that's why it spread out faster and wider. But we know the strength of China. They are trying to cope. Hospitals build within weeks, 10 days. Put up big hospital, 1,000 bed capacity. You can't imagine that. This is how serious they are trying to tackle this event. Now let's come home. This is happening all the way in China, but we are not an island. And I have mentioned the relationship we have with China in bilateral relationship, either cultural, either trade, either learning. We have a lot of students there. Our business people are going. We have a lot of Chinese expatriates in this country in different fields of work, in different parts of the country. And most of them went for holiday. And some of them are still there, some of them are coming, some of them came before the outbreak was pronounced. What are we doing as a country, as a ministry? I think we've started this before. We've told you some of the activities that we have embarked upon. I've been on AYV television, 2 programs, the Nightline and the other one, I don't remember how they call it, in the morning. Wake Up Sierra Leone. I was there also. And Harold have been on various media houses to tell you people what is happening. In the first place, here we call on weekly basis what we call EPRG meeting. That is Emergency Preparedness, Resilience and Response Group meeting. That meeting was established during Ebola. But we have continued with it because we are preparing ever since after the Ebola outbreak. You don't prepare for war during war. You prepare for war during peace. We have been preparing for this. That's why this directory was created. And all the components programs are there to ensure that we are properly prepared. To start with, we have different modes of operation here. During normal times, when there are no diseases, we are monitoring. We call that the watch mode. The watch mode is we are looking at the routine data. Every week in this room, we look at all the information we collect from the 1,300 facilities in this country. Every week with all our partners. And that's why you see the One Health platform. Ministry of Agriculture, Environment, ONS, we all meet here to do presentation on the indicators that we are looking at. That is the watch mode. When we have a suspected case of public health interest, we move from that watch mode to alert mode. To alert mode. Alert means we are not only watching now, we are opening all our eyes. We are not declare anything yet, but we are just watching still. Okay, this is the case where we are now. We are now in alert mode as far as coronavirus is concerned, because we have not got any case in country yet. So we are preparing. We have heightened our preparation. So information number 1 is we have not got any suspected case here yet, to our knowledge. We don't have any suspected case yet. We activated the EOC from watch to alert mode, and then we heightened surveillance. We have visited the airport because this is airborne, and because it's originating from China, and the only way the virus will get here is through by air, by flights, for either visitors returning from China or students or whatever, business people going to China and coming back. That is the only logical means of getting the virus here. So therefore, we targeted the point of entry, that is Lunge Airport. We went there to put things in place. What are the things we went there to put in place? 1, IPC. We want to heighten IPC. IPC is Infection Prevention and Control. If you go to Lunge now, or if you have a relative returning, flying into this country, you ask them, they will testify that there are hand washing stations at the airport at the arrival before even you get to the immigration. Why do we do that? Because as Harold said, precautionarily, you need to be washing your hands if you touch surfaces, or maybe if you touch surfaces, somebody infected have played with it, you may get the infection. So the first thing, you wash your hand before you get into the terminal building, the arrival building. You wash your hand and they take your temperature. We take temperature at 2 layers. We have the infrared we used to use during Ebola. Now we point at you, the gun. They will take that one. If you are okay, you come into the building, and there's a big screen while you are queuing to get to the immigration. They call thermoscan, just like that screen you are seeing. That one will take your temperature without you not knowing. There's somebody standing there. Somebody will take your temperature without you not knowing. You pass through. If you have temperature, then they will call you aside for interrogation to ask you travel history before even looking at your disembarkment form or your passport. Any passenger, we are not looking at only who comes from China. As long as you are you are alighting from a plane, you want to enter the airport, it is the immigration that will ask you where you are coming from. The POE, we call point of entry staff, they will not ask you where you are coming from. All what they do is to ensure that you wash your hand and they take your temperature. Then you come to the immigration. From the immigration now, they will look at your passport and see whether you are coming from China or not. You will not deny that, because if you went to China or you are coming from China, they will stamp your passport, either in or out. They will know. So we have put that in place now. And of course, the airport people, the entire staff at the airport, from immigration officers to ground handlers to baggage to security, those who search people, they were all worried, and genuinely worried for this, because they are the front line. They are exposed to if there's going to be any importation. These are the first people that are supposed to come into contact with the virus. So what have we planned to do for them? Training to orientate all of them. All of them. About 500 of them to orientate all of them. And not only them, even those at the air taxi. You know, how do you call them? C coach and C bad, because they are also handling passengers. So we are going to include all of them in the training, and the training is starting today is Tuesday. Yes, WHO supporting us. We are starting that by next tomorrow. We are starting that immediately to start and we are going to do it back to back, so that we can complete the training within 3 or 4 days, and then we are done with them. POE, we are going to establish isolation unit, temporary isolation unit at the airport. The military have gone to inspect the site. They are ready to move their equipment to go there and to install 3 tents. 2 for possible. We don't have any case now. We are just preparing. 2 for any possible suspected case will be held there for sample collection, and the 1 for the staff. That is that. And then we have supplied IPC materials to them to be using. What are they? And liquid soap to wash their hands. That is 1. 2, face mask and N95 mask. We supply them, and PPEs. We supply them to wear that, particularly those who are the front line. We also went to look at the preparedness of the airport. They are, as I said, they are very agitated. They are very cooperative. We held a long meeting, a 1 whole day meeting with them, with all of them. They have identified a space wherein they can detain or isolate a case, a suspected case. But then the isolation was just behind immigration desk. That will have exposed them if we have to leave it like that. So we advise that it shouldn't be within the terminal building, it should be outside. And that's why that's a technical eye. They did not think of that. They just said, oh, this is nice, we can put it there. But we have rearranged that. So that is what we are put in place. The next one is what we call locator form. Locator form is a form that we request for passengers' detail. Your name, where are you coming from, where will you be staying if you enter in Freetown or any part of the country, and your telephone number, your contact telephone number. Why are we asking for that? We're asking for that because this disease, maybe I failed to mention this, the thing that makes coronavirus special as compared to Ebola is that with Ebola or Lassa fever, you cannot infect someone if you are not symptomatic. If you are not symptomatic, you cannot infect someone. But with coronavirus, even though it's new, study is undergoing, and there are some results indicating, it is still not definitive yet, it is indicating that asymptomatic infected individuals, asymptomatic, that is somebody who is infected but is not sick yet, is not showing any signs of symptoms of sick illness yet, that is during the incubation period, that 14 days we're talking about. Within the 14 days, it doesn't mean exactly 14 days, it's between 1 to 14 days, depending on your health status, depending on the point of entry of the virus into your system. If the virus enters your eye, your incubation period is shorter. If the virus enters your eye, the incubation period is shorter. So that's why it's between 1 to 14 days, any time between that. So if somebody is asymptomatic but infected, that is the incubation period, they will not pick them at the airport. They will pass through, because you only pick those who are sick. You don't pick those who are not sick. Okay, so that's why we are introducing the locator card. The locator card is meant for those who are not symptomatic, who will go through immigration. But then you will now indicate your name, your address, and specifically your telephone number. For those who have traveled widely, whenever there's an outbreak and you go to developed countries, for the US, for example, when you go, they give you a phone and a thermometer. You report yourself, you monitor yourself, and you report to the surveillance people, the head of authorities, if you are sick. Anytime you have fever, and in some instances, they even come periodically to check again, even though you are reporting on yourself. That's self-reporting. They come to check again. Here, we don't have the luxury to do that, to give phone to every passenger that is coming through. Okay, what we can do is request for your telephone number so that our surveillance officers can monitor you for 14 days within the incubation period, as well as to give you health education at the point of entry, that if you become symptomatic, or even before that, when you get to your home, to your family, make sure you keep away from them for 14 days, because if you are going to infect anyone, it's going to be your immediate family, your wife, your children, your relatives. If you don't do that, because that's very serious, we tell you, when you go in, please make sure you keep away, keep a distance within your family member after 14 days. Now, if there's no signs and symptoms, then you are free to go around. So I will give you the leaflet and that. So those are the preparations we have put in place. Apart from Lungi, we all know that either because of proximity or because of difference in cost of air ticket, some of our business people will go to Guinea and buy a ticket and fly to China and return back the same route. We are aware of that. So because of that, we do not only stop at Lungi. We have been to Balamuya and Jendema. These are the two major crossing points. We are also aware of the fact that there are so many other porous crossing points that are unmanned, and in fact impossible for us to effectively man. We don't have the staff to do so. But we are not very epidemiologically, we are not too worried about those crossing points. Why? Because the possibility of someone flying to China, or maybe for business or maybe a student coming through crossing point that they have to use cross the river on foot is very unlikely. I'm not saying it's not possible, but it's very unlikely. I have worked in all the districts that have borders with our international boundaries. I've worked in Kwanadugu for 2 years. I know all the crossing points. I know the type of people that cross there. I work in Kenema. Kenema was my last station before I came here. During Ebola, I managed Ebola in Kenema. I know all the crossing points. I work in Pujao. I know all the crossing points. I'm coming from Kailao. I know all the crossing points. The type of people that uses that one, of course, these are our people, our regular people, not those who are going to China. So epidemiologically, we are focusing on Lungi Airport, Balamuya, and Jendema. These are the three major crossing points we think is likely. If anyone has to come in here with that virus, has to come through that. I'm not excluding the others, but I'm saying epidemiologically, it is very unlikely that people who have the ability to fly to China are coming through those areas. Okay? So we have also gone to Balamuya, we have put things in place. We have gone to Jendema, we have put in place. The DMOs and the DHMTs have been advised and have been supported to engage all their partners in the district to heighten IPC. Take surveillance, the IPC stuff to PHUs, especially those along the crossing points, so that they can heighten up the surveillance. We have put all of that in place to ensure, because as of now, what we need to do is to tighten surveillance, to strengthen surveillance, and also communication. We have started engaging the media, and we are coming out vigorously. The plans have been finalized. We have secure funding. Is coming out vigorously, using all platforms available, the television, the radio, social media, even the comedians. We want to bring even the comedians. We are bringing the comedians on board to increase awareness, for people to know that it is there and what to do to prevent yourself. Because the prevention, we are not only focusing on the airport, we also want to focus internally. Although we are expecting the virus to be imported, because we don't have any indigenous coronavirus here. It has to come from outside. But before it comes, we have to prepare the ground for the people. So that in case, we are not praying for that. We pray it doesn't come. And that is our prayers. But then prayers alone is not enough. We all know that. We need to put action. And we are all responsible. All of us are responsible. The Ministry of Health will take the lead. Of course, you the media guys, you are also responsible to tell the people that we need to do and pass the right information to them. And they also have responsibility to safeguard for themselves and their immediate family members. For example, as I said, if you are traveling from outside, you want to disguise, or you come to the immigration. Now we warn you, when you go back to your family, please ensure that you keep a distance from them. Otherwise, if you are going to infect anyone, you are not going to infect the journalist, you are not going to infect Dr. Vandy or Harold. The first person we infect is either your wife or your children, because these are those who come closer to you. You breathe. If the virus is in you are now infected, you pass it on to them. So you have to take precautionary measures to ensure that you don't pass the virus to the next person. So these are the activities. These are the plans, activities we are put in place, and we are monitoring all over the place. Genema, this morning I got in touch with the DMO. They are going to erect isolation unit. They have the tent there. They have engaged the military there to assist them to do the erection. Balamoya, they have isolation unit already. Every district has isolation unit that was built during the recovery period of the Ebola. They have them. Some districts, even some PHUs have. We have about 5 Belmont Center in every district that has holdings have isolation units. So those ones we have asked all of them to clean and to ensure that these ones are ready in case there is need to use them. We don't have any need to use them now, but we are preparing, and we are preparing for the worst. We know our economy is not strong. We cannot afford it. Even China, with their might, for those who know commerce, they lost the stock market is troubling. They have lost billions of dollars just within this few. In fact, they have not calculated all the loss yet. It's just for now. Just imagine those who are canceling flights to America. What will be the impact of that on the airlines? America alone has 14,000 people traveling to China every day. 14,000. And they have over 149 international airports. And now they have reduced that to few. It's huge economic impact. Factories are closing. Some are relocating. Some are rethinking. So a huge part. With China, with that might, even the health system is stronger, far stronger than ours. It's on its knees, although they are doing their level best to contain it. So we don't want that to come here at all. We don't want it to come at all. So all of us should join hands together to ensure that does not happen. How are we going to? We are all responsible. You can do it in your own little way by passing on the appropriate information to the public, to your immediate ones, your loved ones. All of us have family here. You have to educate them appropriately. To the public, to your co-workers, that this is what we need to do. The virus is dangerous for the fact that it's airborne. It's not virulent as Ebola. It is not as virulent as Ebola. But it is dangerous because it is airborne. I don't need to touch you to infect you. And you don't see it. You don't smell it. You don't touch it. So that's how dangerous it is. So all of us need to take precaution in one way or the other. And we are all responsible to ensure we keep our country safe from this. A weak economy, if we allow Ebola to come coronavirus to come in, it will be disastrous for us. Fortunately, none of the African countries have reported a positive case as of date. WHO have classified countries at risk. There are 3 levels of risk. Level 1, those that have high volume of traffic between their countries and China, and like Kenya, because they have it's a transit point, and they have direct flight to China. Ethiopia has direct flight to China. Those ones are in level 1 of risk in Africa. But up to date, they had suspected cases, but they were all cleared of coronavirus. They were negative. Ghana in West Africa is level 2. Ghana and Guinea is level 2. Guinea-Conakry level 2. We are the only country in West Africa we are in level 3, Sierra Leone. Meaning we are not too at risk compared to Guinea, to Ghana, and to the other countries. But even at that, we still have to be cautious. We should not be complacent with that rating, even at that. Because if there is an outbreak in Guinea, it's here. We'll see how porous the borders are. We have our people over there. You can even go to Guinea without passport, even without laissez-passer. Not so. Without an ID card, you can cross to Guinea. So we are also trying to link with them to see what they can put in place to tighten their system, as we are doing, so that we are on the same platform to ensure we don't allow it in the sub-region at all. Because, as I said, coronavirus is a serious business, very serious issue, and we are taking it very seriously. On Friday, on yesterday, we attended a meeting with the ONS, with all the players, from immigration to IG to the military, all the other staff members were there, and other sectors. On Friday, we are having interministerial committee meeting. There we call all the ministers, foreign affairs, all of them will be meeting here to further discuss this, because it's a continuous process. The preparedness is not one-off and prepare and you sit down. No, it's continuous. As things unfold, you continue planning until maybe the epidemic will be over. We have to continue planning. It's not static. Not that what we have done is okay and okay, we have done our best, let's sit down and pray. We continue planning and doing what we are supposed to do, and we also add some prayers to it that it doesn't come. So thank you very much for your coming and for your attention, as well as for your time.
As not listening to the signs and symptoms of the coronavirus, and also within the Sierra Leone Ministry of Health and Sanitation don't put in place for city people within a Sierra Leone safe from the virus. Me we carry this program to on today. Me your name na Aissatou Smile Sisi. Until we meet again, I say tata.